Hi Jim, my name's Ethan. I'm gonna go over some liver labs with you. It looks like you have 3 ordered. One's an AST, one's an ALT, one's an ALP. I'll go over each one individually with you. Just let me know as we go along if you have any questions, okay? So the AST, the normal range for males in your case, would be 10 to 40 units per liter. The purpose of this test is to detect acute hepatic disease, monitor progress, chronic, would be chronic and cardiac and hepatic diseases, and then signs and symptoms of an increased value would be fatigue, jaundice, itchy skin, and right upper quadrant pain. Signs and symptoms of decreased value would be muscle weakness, fatigue, difficulty with protein metabolism. Implications of increased AST would be heart attack, cirrhosis, hepatitis, and then implications of decreased AST would resolve of the disease. Any questions so far, Jim? Okay. So the nursing considerations before and after the testing would be just to verify you by 2 patient identifiers. The AST evaluates for liver and heart function, just to let you know that again. And then this test consists of 3 venipunctures, which is just a blood draw through the vein. One happens on the first day that you're here, and then one on the second, and then one on the third. And then there's no food or fluid restrictions for this. And then there is going to be some tourniquet discomfort. So the ALT that I talked about a little bit earlier is the normal reference value for male is 10 to 40 units per milliliter. This is to detect and evaluate hepatic diseases, especially hepatitis and cirrhosis without jaundice, and it helps to distinguish between myocardial and hepatic issues, and also hepatotoxic with any drugs. And then signs and symptoms of an increased value is loss of appetite, jaundice, and dark urine. Signs and symptoms of decreased value is generalized weakness and fatigue. Implications of increase is large amount of liver damage and hepatitis. And then implications of decreased would be liver disease. And then we would have to do pretty much the same nursing considerations as the AST, just to verify by 2 patient identifiers. And then it requires a blood sample, so we're going to do that tourniquet and venipuncture again. And then this one, it has no food or drink restrictions also. And then the ALP, did you have any questions for the ALT, Jim? Okay. The ALP normal range is 50 to 120 units per milliliter. The purpose of this test is to detect skeletal disease and focal hepatic lesions causing biliary obstructions. The signs and symptoms of an increased value is jaundice and bone pain and itchy skin. Signs and symptoms of decreased value is numbness and tingling. Implications of increased is biliary obstructions, active cirrhosis, and viral hepatitis. Implications of decreased is protein, magnesium, and deficiency. And then we're just going to identify you by those patient identifiers again. And then assess liver and bone function, just let you know that. And then you would need to fast for at least 8 hours for this test. So usually it would be done in the morning time. And then just let you know it requires a blood sample again. So you're going to have that same feeling of the tourniquet and venipuncture once again. And then that's all the tests that I'm going to go over with you, Jim. Do you have any questions for me?